Okay, so now we're going to look further at some different tests. Now, as I kind of go through these tests, as far as like the overall procedure, I'm probably going to go through this fairly quickly. The key I want you to kind of take away is number one, know all of your different areas that you're testing, okay? So in other words, all our testing categories. So for instance, here we're talking about cardiovascular endurance tests. We'll be talking about tests for muscular strength, local muscular endurance, so on and so forth. So first of all, know which tests fall into all of those categories. That's number one. Number two, within those tests, are there any tests that are, maybe a little too intense for somebody with certain health conditions? In other words, if you're given the option of more than one test, is there a certain test that's more applicable to different populations? That's another key you want to look for as you're kind of going through all this. And then, kind of the differentiating factors between those, okay? So, certainly note the procedures and everything like that. You're not going to be responsible for any long form description of the test. But if there are particular things with the test that are important as far as the outcomes, make sure that you kind of highlight that for yourself and that you're aware of that as we kind of go through. So when we look at our cardiovascular endurance test, we have two treadmill tests we're going to talk about. There's the Bruce treadmill test, which begins at a very slow speed, but a steep incline, and then every 3 minutes, the speed and the percent grade increase until volitional fatigue is attained. And then there's what's called the bulk wear treadmill protocol, which begins at a speed of 3.4 and a 0% grade, and the speed doesn't change. So the Bruce treadmill test is a little more appropriate for you would say, typically a younger, more physically active population. That would be a little bit better as opposed to the bulk wear, which is a little more preferred for individuals that maybe have known chronic disease or disabilities and or maybe in the past has been very inactive. So there's kind of advantages and disadvantages to each one, but that's essentially the thing you would kind of want to look at. At the beginning of the second minute, the grade is set to 2% and increased by 1%. This is going on with the bulk wear until volitional fatigue is reached. So again, there are two differences as far as intensities are concerned. And then as you kind of move along, I'll talk a bit on the next slide about how the scoring takes place with these tests. So again, to estimate the VO2 max for both of those, you take the exercise duration spent during the test and use one of the equations from table 2.4 in your text. So that could kind of tell you where you're at as far as estimating your VO2 max. Always remember as well, as we had talked about during each stage of any of the treadmill tests, make sure to get some other data to see how the patient or the client is responding to the test. So get a rating of perceived exertion, get heart rate data, if possible, take a blood pressure as well, just to kind of see that they're responding appropriately to the gradual increases in intensity. So the YMCA step test, so you're gonna need a metronome for this, and actually you could find a metronome online, so you can even pull it up on your phone. There's actually probably apps, and what the idea behind the metronome is it sets a pace for the person. So we want to set the metronome to 96 beats or 24 steps per minute, and basically you need a stopwatch, and basically for 3 minutes you have a person step up and step down with the beat of the metronome to, and again, that's just so that they don't go too fast or too slow. They kind of keep that perfect pace. So the client should continue stepping in time with the metronome. As time expires, you have the client immediately sit down and take the pulse for 1 minute, and then score the test is the heart rate during that minute. Okay, so once they immediately sit down, take the pulse for a full minute, and then you will get the heart rate, and that's basically what their score essentially is. Okay, so looking at some other tests, we have what's called the recumbent stepper. So basically an individual, it would be required to maintain a step rate of 100 steps per minute for the entire test. And the work rate for stage 1 would be the same for all clients. You would set it at 30 watts, and the subsequent work rates are assigned based upon the heart rate's response from stage 1. So basically, you'll be taking heart rates at various stages, as you're seeing here. So the heart rate should be taken during the final 10 seconds of minutes 2 and 3 of each stage to just determine if a steady state heart rate or a change in no more than plus or 5 minutes has been attained. If the steady state heart rate hasn't been attained, then the current work rate should be maintained for an additional minute and the heart rate should be taken again. So then that would determine the appropriate work rates for stages 2 through 4, and then the client's rating of perceived exertion should be measured during the final minute that each work rate is recorded. And the test should continue until volitional fatigue has been achieved or achievement of 85% of age predicted max heart rate. And again, you could use the equation in the book to determine your VO2 max from the final work rate and heart rate. So again, this is just another example of a different type of test. If you have the recumbent stepper, you can utilize that as an additional test to test for cardiovascular endurance. Okay, so then you also have the YMCA cycle ergometer test. Okay, so here you'd obviously need a cycle ergometer, and you can, obviously attain a stopwatch and a rating of perceived exertion chart to be able to take this test out. So clients are required to maintain a constant pedal rate of 50 revolutions per minute using a 6 meter per revolution flywheel for the entire test. So, so this would basically be, again, kind of your standard protocols for carrying this out. So you have to make sure you have that. Here we talk about your work rate for stage 1. It's going to basically be the same for all clients. And then the subsequent work rates would be assigned based on the heart rate response from that first stage. If the heart rate at minute 2 and 3 is not within 5 beats per minute, continue for 1 additional minute at the same intensity. So basically, like we looked at with the previous test, basically the work rate that they're going to be working at is going to be dependent upon their heart rate response. So you're going to have to be taking heart rates throughout this again. So you want to make sure that you're obviously very, very proficient at doing so. And the rating of perceived exertion should be measured during the final minute of each work rate and record it. So you want to make sure that you're also being able to track and monitor the rating of perceived exertion. So again, with the cycle ergometer test, you should continue until volitional fatigue or achievement of about 85% of age predicted maximal heart rate. Then again, determine appropriate work rates for stages 2 through 4. And then what you'll do is you plot each heart rate obtained for every work rate from the test and then draw a diagonal line through the points. So you actually create a graph, and I have an example of this. It's the same example that's in your textbook. And you could actually see, so you draw a diagonal line through the data points that extend through the age predicted max heart rate and extend the line downward to the horizontal on the graph, and that kind of estimates your maximal work rate. And then you can basically translate the maximal work rate into an estimated VO2 max using a metabolic equation, and you could take a look at that in your book. They could kind of show you that equation in figure 2.6. Okay, so here's the graph from the book, and in this they use a hypothetical individual. So we have a 38-year-old client. So you find their maximal heart rate, which is 220 minus their age, so that gives you 182 beats per minute. So during the first stage, they had a heart rate of 90 beats per minute, okay? And then they went from 190 to 130 to 155. So those were basically the 3 heart rates that were measured during the stages. And then, as they said, basically what you do is you take a line and you kind of draw it through those as best you can to the point of where their maximal heart rate would be, which is 182 beats per minute. And then from there, you draw a line down that gives you what essentially that estimates what their maximal work rate would be. So the maximal work rate based on this and plotting everything puts them at 750 as their maximal work rate. So what you'd basically do is you would plug this in into the equation, and that would give you your estimated VO2 max for their result as far as what it would be estimated based upon those numbers. So that's how you would figure this out utilizing the graph with the cycle ergometer test. So we have the arm ergometer test. Okay, so again, using again, making sure that the person, you want to make sure that they have proper posture while utilizing this. So using proper posture, they'll use an arm crank speed of 75 to 80 revolutions per minute, and that must be maintained for the duration of the test. The beginning work rate is around 10 watts, and the work rate should be increased an additional 10 watts every 2 minutes until volitional fatigue or until the 75 revolutions per minute cannot be maintained. Then you're going to convert, again, here you're going to have a conversion. So you're going to convert the maximal work rate in watts to kilogram force meters per minute by multiplying by 6.2. Then using the maximal work rate during that, you use that to calculate your VO2 max. And that's going to be the formula you would use. So you first have to take the maximal work rate in watts to what they got to, and multiply that by 6.12 to turn it to kilogram force meters per minute, because that's what you have to use in the equation in order to do so. So basically you'll keep them going up 10 watts every 2 minutes until basically they can no longer continue with the test. So the muscular strength test. So muscular strength testing is carried out to assess various factors. So we look at maximal force, we look at the smoothness of contraction and relaxation, we look at the balance between different muscle groups, and we look at symmetry. So everything we're looking for, again, we're looking at general health. We're not so much concerned about someone having, crazy amounts of strength, but we want to see a good amount of strength, and we want to see muscular balance is very important in all of this. So again, muscular strength is defined as the force that a muscle or muscle group can exert in a single maximal effort while maintaining proper form. And there are ways you can estimate if you don't want to find a true 1 rep max. Again, as long as you're taking them to the point where they still have proper form, taking a single max effort attempt is not necessarily any more or less dangerous. I mean, you also want to take into consideration the person's prior strength training experience, but you want to make sure, again, that the key there would be with proper form. Once you start to see form start to break down, again, you're in all likelihood you're not working with somebody who's going to be a power lifter or something. Maintaining good form or having what would even call maybe like a technical 1 rep max is something I like to use for individuals like this. That would be something that would be more functional for them. Okay, so for testing upper body strength, we're going to look at the 1 rep max bench press procedure. So obviously we want to make sure that we're working up accordingly with an appropriate amount of weight, making sure we're warming up. So, and there's various ways you can do this, and we could even chat in class a little bit more as far as like, what are some other ways. But I think the guidelines that your book gives you is a good starting point. So again, the client will perform an exercise-specific warm-up. You'll use 5 to 10 repetitions, again, using a light to moderate load first. And this would start with, weight as light as just even using the barbell when you're doing this. Then next, the client would perform an additional 2 heavier warm-up sets of 2 to 5 reps, somewhere in the 60 to 80%. I mean, hopefully the individual has an idea as to what they think they want to hit. Now, that could be a little bit more challenging when you're dealing with, somebody who, has very little experience, or maybe has, never really done a bench press. And we could talk about, if someone's never bench pressed before, are we really going to test their 1 rep max bench press, or would we wait, until they maybe train for a little bit just to kind of see where they're at? That could be a little discussion point that we get into when we're in class. And again, the resistance, you just progressively increase. And again, you want to be, kind of conservative with it. And you'll eventually start them working at, 1 rep attempts once they've kind of covered the previous step. Now, with each attempt, you want to make sure you're allowing enough recovery. Again, the idea here is that you're testing someone's strength. So you want to make sure that they're taking long enough recovery periods. So once the weight starts to get heavier, you don't necessarily have to wait this long, after you do like an initial warm up with, say, the bar or even a really, really lightweight. But once you kind of hit that 60 to 80%, you definitely want to be taking at least 2 to 4 minutes. And again, that's just to allow for total, complete recovery, make sure your nervous system has at least, made its way to just about complete recovery. And again, you can increase and decrease the load until the client can only do 1 repetition. And again, the key really with this is make sure that, when you're testing particularly general population and those that don't have a lot of experience, I would really reinforce this is to make sure that it's, again, as I would call it, a technical max. So, what's the, when do you start to see form start to degrade? So if you see the form start to degrade or the repetition's really taking a long time, that's at the point where you definitely want to know. Even if you think they might be able to do a little bit more, that's where you would stick with your 1 rep max. And again, try to get it within 3 to 5 total trials, okay? Because you want to make sure you're doing that. So, kind of have an idea, or the individual hopefully has an idea in as far as making sure that, that you kind of know where you're going to hit, so you can kind of build up those warm-up attempts as they're progressing. Okay, so for the lower body, the chapter talks about utilizing the leg press for testing lower body strength. We'll talk a little bit about in class about maybe some other things that, someone who's maybe a little bit healthier without any problems can possibly do as far as the lower body is concerned. So obviously we're going to be using a leg press machine. So you just want to make sure that the machine set up appropriately for the individual. There's not going to be necessarily one way of setting somebody up, only because there are so many different variations of leg press machines. So it kind of just depends upon what type of leg press you're using. There's, leg press machines where, the classic one, which also has like the kind of hack squat option where you're laying or you're sitting and your legs are kind of doing the pressing. You have the other form where more of the upper body part is moving. So it kind of just depends on the leg press machine, but here we're giving some ideas as to where you want to be and how you kind of generally want to position to make sure that they could get in the proper position for the movement. And really your procedure is going to be pretty much the same as it was for the bench press. Again, you're going to have an idea and gradually work your way up. Again, once you kind of get to that 60 to 80% of where you're going to be at, then you're going to, look at like a 2 to 5 rep range. And then really after that, it's going to be all single attempts. And again, you probably, I would, like I said, you want 3 to 5 heavier attempts just to kind of see where the person's at, and so that you don't have too big of a jump in weight when you're doing this. Typically, the stronger somebody is, and this should make sense, and this would go for the bench press as well, but the stronger somebody is, you're going to naturally have bigger jumps in weight, just because of the fact that you don't want the person taking 10 attempts during a test, so obviously they're going to take much bigger jumps. Somebody who isn't as experienced, the jumps in weight will be much smaller. Okay, some local muscular endurance tests. So the partial curl up. So as you see in the book, the partial curl up, we're looking at the testing the strength of the abdomen or the anterior core. So for this test, you will need a couple pieces of equipment because you're going to want to standardize it. So here we're going to need that metronome again, which again, you could pull a metronome app up on like a phone or an iPad. I believe even if you just do a Google search for a metronome, you can just pull it up on Google and you'll get the metronome, and you could set it for the beats that you want it at. But you'll also need a ruler and some adhesive tape, because what you're essentially going to be doing here is being able to, objectively have a start and end finish when they're doing this. And you can see an illustration of this in the book when you're doing it. So the client will lie supine on the mat, their arms by their side, their elbows extended, palms flat on the mat, their knees flexed to 90 degrees. And basically what you'll be doing is you'll place a piece of tape on the tip of the fingers of each hand, and then a second piece of tape parallel to that about 4 inches away. So that's what you're going to be looking at for your setup, because the idea is as they curl up, and if you look at the illustration in your book, you could kind of see how they'll sort of slide their way up, and each time they touch the tape, that basically constitutes a repetition. So again, there you have how the client will put the piece of tape. This is what I just talked about earlier, about 10 centimeters or 4 inches away. So you'll set the metronome at 50 beats per minute. So have the client curl forward and upward. They'll lift their shoulder blades up off the exercise mat by flexing the trunk to about 30 degrees in time with the metronome. So you're looking at about 25 curl ups per minute. And then here's the key with this, and this kind of becomes the problem sometimes with a lot of abdominal exercises. You want to make sure that the client avoids flexing their neck, and that they just perform as many curl ups as possible in 1 minute without pausing until they can no longer reach the piece of the tape, or they could complete a maximum of 25 repetitions. And then the scores for the total number of curl ups completed, and you can see the norms for the test here. So that's what you're going to be looking at. And again, this will test the muscular endurance of the abdomen, which when you look at the abdominal muscles, that's one of the things you're really looking for, because if you look at what the role of the abdominal muscles are in stabilizing the trunk and pelvis, that's there's a little bit more of an endurance need for that particular muscle group. So here's the figure. So this is just what I was talking about. So if you look at the mat, so you'll put a piece of tape by the person's tips of their fingers, and then about 4 inches away, you'll put another one. And then you'll notice, again, what she's going to basically be doing is, as she curls up, she's objectively kind of completed the curl up when her fingers have essentially gotten to the second and then go back down. What you do want to be careful is you want to watch the neck, particularly as they fatigue. They'll start to kind of flex their neck a little bit more, which you just don't want. It could obviously make their neck sore after they've done so, and that's a common fault that you see with a lot of abdominal exercises, just even when people are performing them. Okay, so flexibility. So when we look at flexibility, so flexibility is defined as the range of motion that can be performed by a joint of the body. So again, we want to make sure that we, obviously, even as we age, we want to make sure we maintain a degree of flexibility, and it's really important to make sure that joints have what we call a functional range of motion. Again, sometimes gaining flexibility for the sake of gaining flexibility isn't the best idea, but being able to have an optimal range of motion is really important, so that you don't end up utilizing other joints and movements and compensating in that fashion. So again, maintaining flexibility of all joints, it's optimal movement and function. Again, if you stress a joint beyond its range of motion, tissue damage could occur. Or when you ask a joint to maybe do something with a movement it's not supposed to, that could also happen. So for instance, very common, I would say probably one of the more common flexibility mobility issues that you see with people is that they lack mobility at their hips, and then they tend to move. It puts a little bit more stress on their spine. We'll talk about in the musculoskeletal disorders chapter about how common low back pain is, and we'll actually spend a lot of time talking about low back pain and some things that we can do for the population to kind of help with that. And again, flexibility is joint specific, so there's no single test of flexibility. We're going to talk about obviously some specific ones. One of them being the sit and reach test, which is one that gets done, and the sit and reach test, I would even say kind of has some of its own faults, but again, it's a general screening tool that you can use. Again, all of these screening tools, and in particular for flexibility, again, you got to kind of look at them big picture and kind of see, what other things may need to be addressed. But it does give you some at least good general information because, again, we want to make sure, particularly in this area when we're talking about, the hip and low back area, that tends to be a very common area where problems come up. So essentially with the sit and reach test, you're essentially looking at the flexibility of the hamstrings and the lumbar spine, okay? And you're kind of looking at the interaction between the two. So for the procedure, I'll talk about the general procedure to prepare the person because then depending upon how you're measuring it is going to depend upon what you have at your disposal to use. They do actually make a sit and reach box, which we have. And I'll show you how to use that. You can also just use a measuring tape or a measuring stick to do that. And the procedure kind of talks about it from both perspectives. Either way, it kind of gives you that general idea as far as what you can do. Some of these points I'm a little bit more concerned about. You make sure the patient has their shoes off, make sure they do warm up a little bit, including doing some mobility work to kind of prepare themselves. Again, have their shoes off, they place their feet at the base of the box. If they're using a sit and reach box, knees and arms will be fully extended, hands evenly overlapped. You'll have them reach forward slowly and have them exhale, encourage them to exhale as they go. So breathing does impact your mobility. So if they hold their breath, it's actually going to cause, it kind of causes, without getting into the whole science behind it at this point, it does kind of cause the system to sort of tighten up, if you will. So make sure they kind of exhale and breathe out as they come forward. That will certainly allow them to get as much motion as they can out of it, and they should really hold their final position for at least 2 seconds. So, I mean, you figure by the time you look at their number, write it down, that's 2 seconds, then they should be fine. And you'll take the best of 3 trials. So you do at least 3 trials, so you'll see, usually obviously after, at least going once, it kind of further sort of allows the warm-up to have its effect. So do 3 trials and see what they do, and then again, compare your scores. So again, always be referring to these tables. I'm not going to make you memorize norm tables and numbers, but it kind of gives you an idea as to about what you're going to be looking for normal values for individuals. Okay, the back scratch test. So the back scratch test will kind of test general mobility of the shoulder joint, shoulder girdle. So basically looking at upper body mobility. It's kind of a rough general test, but it does kind of give you an idea as far as like what someone would be looking at as far as upper body flexibility and mobility. Client should stand and place their feet with the preferred hand over the same side shoulder with the palm down and fingers fully extended. So, and I'll kind of show you this in class as well, and we'll be, again, we'll be doing a lot of things with this in lab. But, if you could picture kind of bringing your arm up over your head to like scratch your upper back, that's essentially what you're looking to do. So your palm down and your fingers fully extended. Then you reach down the middle of the back as far as possible. So again, picture yourself trying to scratch your upper back. That's why it's called the back scratch test. Then we look at, with the other hand, the opposite arm will be around the back and with the dorsal surface of the hand touching the back. So now you're reaching up with your other hand. So your dominant hand would come up and over and be with the upper part of your back. Your other hand then will come up your lower back, and then basically you're trying to reach up as far as possible. And what you're basically trying to do is attempt to touch or overlap your extended middle fingers is essentially what you're looking to do. And because that's where the scoring for this comes in, which we'll talk about in a bit. And again, you could do some practice attempts just to kind of determine preferred position. And again, encourage them not to grip the fingers of the opposite hands together and pull. You obviously don't want them to obviously injure their shoulders doing this. So you're just looking to see if they can either touch or if they could overlap. So here's the scoring. So record the two scores to the nearest ½ inch or 1 centimeter, measuring the distance overlap or the distance between the tips of the middle fingers, with the higher of the two scores recorded as the overall score. So you will use, they say a yardstick or a meter stick. We could probably even just use a tape measure to do this. Now, what you can do is you can also kind of rough score it. So these are the ways it can get scored. If the fingers don't touch at all, that would be a minus. A 0 is if the middle fingers just barely touch each other, and it's a plus score if the fingers overlap. So essentially what you would do is you're going to record your score to the nearest ½ inch or 1 centimeter, measuring with the distance, and then you're basically awarded one of those following scores based upon whether or not they overlap, whether or not whether they touch, or whether they don't touch at all. Okay, so measuring anthropometry and body composition, there's various ways that you can, again, measure this with utilizing various tools. One of the commonly used measures is, and you see this a lot as it relates to a lot of medical charts and everything, document a person's body mass index. So again, to do body mass index, you're basically going to be needing a scale or a balance. It could be calibrated or just any type of scale, and then you're looking at, you have to also be able to measure the height. Now, interestingly enough, BMI is a measurement of fat distribution. It doesn't assess body composition. So that's something to make note of. So sometimes BMI, particularly for very active individuals, if they do a lot of strength training and have above average muscle mass, this could sometimes not give a very accurate measure of their body mass. So for instance, it could actually, if someone does have an above average lean tissue mass and their weight is more because of that relative to their height, they could be in the overweight or obese category and certainly not necessarily be that based upon their body fat percentage. So really, if you really want a full picture, again, a BMI is fine to use, but for active people and people that do things, you're actually going to want to measure body composition to do that. So BMI can be assessed after an accurate measurement of height and weight. So just as I described previously, you want to make sure that you just have an accurate way to measure someone's height and weight. And then basically what you do is you plug to get your BMI, you basically just plug it into this equation, and then that gives you a number. And then you basically take that number that you found, and then that gives you your body mass index. Again, these are the numbers for normal, overweight, and obese. Again, if you have somebody who does do a fair amount of strength training, depending upon their height and weight, you're going to want to do further analysis in as far as finding out what their actual body fat percentage is. And then that kind of gives you a more full picture as far as the person's body composition. Okay, so some other measurements, you have the waist to hip girth ratio. So this is another, possible determining factor for, when, metabolic disease looks at this a lot of times. So measure the circumference of the waist. So basically what you're looking at, again, you need a tape measure, and you need obviously it has to be non-elastic. So again, a lot of the tape measures, for instance, that, we would even use in like, athletic training, sports medicine settings, those would be a type of tape measure that you can use to determine this as well. So you basically measure the circumference of the waist, which is the narrowest portion of the abdomen, and the hip, which is the maximum protrusion of the buttocks. And then you measure that in either inches or centimeters. And then you just determine the waist to hip girth ratio by dividing the waist circumference by the hip circumference, and then you could get your normative values for that. Table 212 gives you your norms for those measurements. All All right, so skin fold measurements, again, this is a very common way to measure body fat percentage, and it's just because of the fact that, it is fairly simple. However, it does require some technique, because again, the idea here is that you're actually measuring the thickness of the subcutaneous fat by using skin folds. So I would encourage you to kind of take a look at the illustrations in the text to kind of see the various sites. And basically, the sites you're going to use are going to be based upon your population and the gender of the athletes that you're utilizing. Those measurements are all available in the table. I'm not going to make you memorize, obviously, skin fold measurement equations. I do want you to know, however, the percentage of body fat and what's considered normal and high for males and females. So if you go to the table, the percent body fat standards for adults, children, and physically active adults, that's table 213 on page 58. I do want you to have a pretty good idea as to those numbers and what they should be, because I may ask questions about those. So make sure that you have kind of taken a look at those and make note of them. You may want to make note. You can even pause it here at some point and just make some notes as you're looking at this as well. So for your skin fold measurements, again, it's based on the assumption that subcutaneous fat thickness is representative of overall body fat. Obviously, we have fat stored and different types of fat stored in different areas of our body. And the thickness of the skin fold is used to estimate body density and calculate their percentage body fat. So, one of the things is with the technique, you obviously want to make sure that when you pinch the skin, you're only pinching the skin and subcutaneous fat. You're not kind of picking up any types of lean tissue with that. And then body density is converted to a percent using population appropriate formulas. And take a look at them just so you can see. You kind of give yourself an idea, because obviously there's various skin folds, but for the equation that you're going to use, you're only going to use the sites that it calls for, okay? When you're looking at determining that. So you'd want to look at, who am I testing? These are the sites that I'm going to use. But you should be aware of all the sites. I'm not going to ask for this equation, what sites do you use, but you should know where all the sites are. Okay, so from a learning testing perspective, one, make sure you know the norm percentages for gender and age. Population, make sure that you also are aware of where all of the test sites are. You don't have to know what equation they necessarily fit into. So for the skin fold measurements, you firmly pinch the skin. The caliper arm should be about 1 to 2 centimeters away from the thumb and finger. You want to make sure it's perpendicular to the skin folds and about halfway between the crest and the base of the fold. So you can kind of see that positioning in those illustrations. Again, this is going to give you the most accurate reading. And then wait about a second or two before reading the caliper and keep the skin pinched while reading the caliper. So you don't want to release the skin or anything that's going to affect your reading. So give yourself 1 to 2 seconds. Read it. Ideally, if you could have somebody recording the numbers for you, it just gets a lot easier, because then you could just kind of call out the numbers and somebody could record it. You may not have that luxury, but if you can, that just does make it a little bit easier. So again, take duplicate measures, because you just want to make sure, again, there could be some measurement error, one time. So again, take duplicate measures of these sites and retest if the duplicate measures are not within 10%. So if you're getting kind of a weird number, kind of do like a little bit of a reset and test again, and rotate through the measurement sites before taking duplicate measures at any additional retest. So, ideally go through all your measurements and then go through again, just kind of see where all of your measurements fall. And then average the 2 closest measurements to the nearest half a millimeter, and then use the equation or another population-specific formula to calculate percent body fat. Okay, so again, ideally here, make sure you know where all of the different measurements are. I actually don't have them in this discussion, but you could look. Well, here, I'll just talk about them right now. You have your chest. You have the mid-axillary, you have the triceps, you have the subscapular, you have the abdomen, you have the suprailiac, the thigh, and the calf. Okay, so now again, you're not going to test all of them, but based upon, and again, you could even do like, again, learning continues beyond this, as I always talk about. So, maybe, professionally when you're working and, if you're doing a lot of skin fold measurements with a caliper, you do some research and you find, hey, they found now for this for this population, these are the 3 best sites to use. So that's going to give me the most accurate measurement. So know that those are all of the places where you measure. Know what your norm values are. I do want you to know the norm values for percent body fat, because I think to have a pretty solid idea of that is a fair and an important thing to kind of know. But you don't have to memorize, obviously, the equations. I'm not going to make you do that. So take a look at those sites, take a look at the illustrations so you can kind of see. Plus, it kind of gives you a pretty fair idea as to like how you kind of want your hands positioned and what you're really looking for. They also do recommend, and I think this is good, if you could mark the areas before you do it. So, they do recommend as a part of your equipment, have a measuring tape and have a pen, because you could kind of mark off the areas. You'll see in the picture that they have a little mark on the individual skin that they're measuring. And that just, again, kind of helps you visually get a good idea as to where you're measuring. Plus, if you have to go back and if you're going back to retest, you're going to be a little bit more consistent with where you're taking your measurements from. So another way to measure body fat is through bioelectrical impedance. And this is a pretty common way as well. The best part about this, about bioelectrical impedance, is that it's very quick. It's easy to do. It's relatively inexpensive. Obviously, there's very expensive ways to measure body fat that are very accurate. So, for instance, the underwater hydrostatic weighing is basically considered the gold standard for body composition. However, the problem is with hydrostatic weighing is the equipment's very expensive. Most people don't have a hydrostatic weighing device. Bioelectrical impedance, you could just even get scales that will do this, that kind of do it all at once. We actually have one of these and we'll be using it, so you'll get to see how that works. But the idea is bioelectrical impedance relies on the relationship between the voltage drop of an electrical signal traveling through fat versus lean tissue. So lean tissue contains more water, therefore the electrical signal travels through much faster because of the fact that lean tissue contains more water, whereas adipose tissue doesn't contain as much water and actually impedes the flow of electricity. So when you're doing a bioelectrical impedance, if you have ever done it before, and you may never have thought of how it works, it's actually a small electrical signal getting actually sent through your body, and the measurement is based upon how much of a voltage drop do you have as that signal travels through the body and back to the machine. Now, with that, again, it's not 100% accurate, and accuracy can fluctuate a little bit, and we'll talk about the ways to make this test as accurate as you possibly can. Again, also understanding the percent error involved when you're doing this, and there's a percent error involved. Like I said, the gold standard is underwater weighing. That's the most accurate. There's going to be percent error involved with this, which again gives you you can get an idea as to where the person still is at, though. And hydration levels, probably one of the big things that will impact this the most. If someone is dehydrated or they're not hydrated appropriately, it's obviously going to impact their testing. It's actually going to overestimate their body fat, because obviously, again, water is what's allowing the electrical signal to kind of travel through the body. So if they're dehydrated, it could kind of overestimate where they're at with their body fat percentage. So again, ideally, another thing you want to make sure is clients with defibrillators should avoid bioelectrical impedance, and that's just because the electrical signal that goes through the body is very light, if you will, but we don't really know the effects. So again, if a client has a defibrillator, they should not do bioelectrical impedance just to make sure that it doesn't end up interfering with the function of the defibrillator. And again, as I talked about, all clients should avoid any type of diuretic unless medically prescribed. They do recommend avoiding caffeine. Now, as a side note, it's been proven that caffeine is actually not a diuretic. But again, just for consistency's sake, avoid caffeine. And a client's menstrual cycle should also be noted for future testing. So by chance, if a female athlete does have her period, you should just know. It doesn't mean she can't take the test. You just want to make sure if that's the case that you note that, so that for future testing when you're kind of comparing results. Another thing that's recommended is exercise should be avoided for 12 hours before a test. So you want to make sure there's at least a 12-hour window between when the individual last worked out or trained. And they should avoid eating and drink only enough to maintain hydration during the final 4 hours before the test. Again, all of these things can impact the accuracy. So, we want to make sure we're at least staying within the standard error, which the standard error for this is plus or minus 4%, which that's the most commonly reported error range. So basically, if everything is perfect and the person, is hydrated appropriately and everything else, you could still have a 4% shift. So they could, say someone comes out and they're 12% body fat. That means they could be as low as 8, they could be as high as 16, but they're somewhere within that range. You just want to try to keep it as accurate as possible. So again, remove any oil or lotion from the skin with alcohol before placing any electrodes on the skin. Again, this depends on what you're using. So, if typically a lot of times individuals will, these could be either handheld devices, they could be just, again, you'll see the one that we have, it's basically just something you step on. So you're actually not placing any electrodes on anybody. Some of them do involve electrodes, but for instance, the one we have doesn't use that. You just basically stand on it. It's essentially just like a scale. And again, place the electrodes precisely if you have electrodes, just because that could impact the accuracy of the test. And then, again, your percent body fat standards, which I'm encouraging you, that I do want you to have a pretty solid idea about, based upon active, inactive adults and where those should be at. Okay, so neuromuscular assessments, and again, these assess balance, coordination, and skill. So this is a really good for testing clients, and they're most useful for clients that have a neuromuscular disability. So that's going to be one of the chapters that we talk about, and it could kind of really give you an idea to see, where some deficits there could be. And again, this could really tell you some ideas, or again, where people really have their deficits and where some problems could come about. And then that would also tell you that specific programming would be needed for that purpose. So if somebody does have a neuromuscular disability or a deficit, these tests can be really helpful in telling you, how much of that does need to be addressed within a physical activity program. And the one that we're going to look at in particular, and we've actually talked about this one in the general strength and conditioning class, the balance error scoring system. This is actually something utilized to also assess for concussions in sports medicine. So this is a very good test. It's been researched and vetted very well. And this is used to assess a client's static postural stability on both hard and soft surfaces. So you do need some equipment for this. You need obviously a hard floor surface, which most people can typically find, but you also need a piece of medium density foam. So if you've ever seen the foam balance pads, they've been kind of standardized for this. They don't have to be any one particular brand, but you want a certain thickness and a certain density. So that's important. So you want a medium density foam pad. Your book gives the measurements for that. I'm not so much concerned that you have that memorized. You just have to know that you need that medium density foam. So you can't just pick any type of foam pad and do it. For it to really be accurate, you need to have a certain density to represent that. And then norms for the tests are presented in table 215. And we're going to go through the procedure for this and talk about the errors that come up, because I do want you to know the errors for this test and what the different stances involve. Okay, so again, static postural stability is evaluated while they stand in 3 positions on a hard floor surface and on a foam pad for a total of 6 evaluation positions. So the foot positions are going to be as follows. So you're going to have double leg support with the feet together and parallel to each other. You're going to have single leg support while standing on the non-dominant foot with the knee of the dominant leg flexed about 90 degrees. And then tandem stance with the dominant foot in the front and the non-dominant foot in the back. Simplest way, and I think I've talked about this before in other classes, you say, well, how do I know what's their dominant, non-dominant foot? I just ask people, if there's a ball there, what foot, what leg would you kick with? That's the dominant foot, okay? So that foot would go, that would be you'd use the non-dominant foot in the single leg stance, and in the tandem stance, you'd put the non-dominant foot in the back. The reason being is if a person is standing in the tandem stance, so the tandem stance is, kind of toe to heel, one foot in front of the other. If you put the dominant foot in the back, you could compensate a little bit more and kind of cheat. So that's the reason why you put the non-dominant foot in the back. So now the scoring for this, when you're doing this. So in each position, the client has to close their eyes and place their hands on their hips and maintain a steady stance for 20 seconds. If they lose their balance, you should instruct them to attempt to regain their initial position as quickly as possible. So that's something you'd want to tell them right away. If you lose your balance, try to get back into the position. So you're given 1 point for each one of the following errors. These are also listed in your book, but I'm actually going to go through these because I do want you to know them. If they lift their hands off of their hips, if they open their eyes, if they step, stumble, or fall, if they move their hip into more than 30 degrees of flexion or abduction, if they lift their forefoot or heel, if they remain out of the test position for more than 5 seconds. Any one of those things is considered an error, okay? And again, a trial's counted as incomplete if the client can't maintain a position for a minimum of 5 seconds, okay? Again, for each incomplete position, the client would receive a 10-point error. So if for some reason they just can't maintain the position at all, it's 10 points, okay, is basically what you give them, okay? In each trial, you count the total number of errors. It's 1 point for each error up to a maximum of 10 for each trial. So once the person gets 10, that's it. And then you get your total number of errors, and that's counted as your overall score. Again, you could see what the norm values would be in table 214 in your book. Okay, so that takes us to our functional performance assessment. So we've kind of gone through looking at kind of individual physical qualities. Well, now we're going to look at just some what we'd call functional tests, which are basically going to combine kind of skills together. So again, there's a wide variety of tests and test batteries developed to look at what we would call functional performance. And again, there's going to be typically a number of tasks kind of associated with these, but typically they're either timed or ranked. And again, what we look at here is we find that if, with some of these basic functional tests an individual would have difficulty with, that it could have a meaningful impact on their independence and disability and potential future disability. So what we're looking at here is, can an individual do like basic functional tasks, because that kind of carries into, when we look at activities of daily living, how would they function? In other words, if they can't pass some basic functional measures. And we could kind of piece things together even with some of the previous tests we've used, but can an individual perform some basic functional tasks? Because if not, then we know that, in daily living, they would, you're looking at either one or two things. You could be looking at: one, how much difficulty do they have doing daily tasks? Or two, what are the risks that they could end up, possibly, injuring themselves from doing daily tasks? So we have the one example given here as far as a functional performance assessment goes. It's called the 8-foot up and go test. So basically, for this test, you're going to need, again, like a lot of them, you need a stopwatch, you need some type of folding chair with a 17-inch seat height, a tape measure, and a cone. You're going to place the 17-inch high chair against the wall with a cone about 8 feet away. On a verbal go, the client's going to come up from the chair and walk as quickly around the cone and back to the chair and return to the seating position. You're going to start the stopwatch on the go signal and stop once the client returns to the fully seated position. And then after a practice trial, you're going to administer 2 tests and record both times to the nearest tenth of a second. The faster the 2 trials are recorded, the score. And then you can look at the standards at the end of the chapter. Okay, so again, that's kind of how you would do this. So basically what you're looking at here is, just a person's ability to sit, stand, walk quickly, and kind of move around the cone and return to their seat. So they should be able to physically do it within a reasonable amount of repetitions. And again, you can look at the scores. You can look at the scores listed in the standards, and again, that kind of gives you an idea just from a basic functional assessment. Again, how would they function in regular life with their activities of daily living? Now, one thing we have to be aware of is, while most people with any reasonable level of physical capabilities can do a lot of the tests that we have, there could be some people that have physical limitations that may prevent them from even starting one of the tests we just talked about. So what we're going to look at there are some valid tests that can be used that are a little less stressful and can still give some very accurate measurements as to their ability. So in other words, these are some tests, the tests that we're looking at here. We're going to go through some examples. So these would be some tests, and again, specifically to note, category-wise, that can be utilized for people that have maybe some more significant disabilities, to where the tests we just talked about might be a little too much for them. In other words, they may not even be able to start the test, okay? So here we're going to talk about the 6-minute walk test, 2-minute step test, 30-second arm curl test, and the chair sit and reach test as some tests that can be utilized for individuals who have more limitations in their physical abilities. So for the 6-minute walk test, again, you could look at the equipment list in the book as far as what you'll be utilizing for this. And basically, what's going to happen is the clients are instructed to walk around the perimeter of a 5-yard by 20-yard box for 6 minutes, and they're given a lap marker as they complete each lap. Now, this is a fairly easy test to perform. Once you kind of get it. Once you basically get it set up, if you're really, you have some really good experience, your book talks about how you could actually test multiple people at once. They actually recommend, in the book to test 2 or more people at a time, just to kind of keep the clients motivated to do as best as they can, because it's one of the things with any of these tests, even, again, what would be categorized as the more challenging tests, I guess, is making sure that the individual is motivated to do it, because obviously that's going to kind of impact their results. So upon completion of the 6 minutes, they're instructed to walk in place for 1 minute as the number of laps and partial laps is tabulated, and then they look at the total yards, and then the standards again are shown there. So basically, you're just going to record the score of each client as total yards, walk per 6-minute period. And again, each lap marker is going to represent 50 yards. So again, the lap markers are basically just anything you can give the individual. So every time a person completes the lap, you give it to them. So every time they complete a lap, you give them an index card. And however many index cards they collect at the end, that's how many laps they've done. And again, each lap marker is going to be 50 yards, and then the distance of the final partial lap gets added to the product of the lap markers. Okay, so again, you have to also consider if they complete a partial lap before the time expires. So that has to get included in their score as well. So with the 2-minute step test, what you're basically going to be doing here is, first of all, you have to determine the minimum step height, and this is an important point for this test. So to find that, you find the midway point between the patella and the iliac crest, and you place a piece of tape on their leg to mark the spot, and then you're going to basically transfer the tape to a wall at the same height. Okay, so you're actually going to be putting that, so that these would be important markers for you to note for this particular test. And then on the go signal, the client's basically going to step in place, and you're going to count the number of times the right knee reaches the proper height. Okay, and the client should slow down or rest momentarily if the knee is not reaching the height. So that's basically what you're going to be doing. If the knee cannot be lifted, to the weight of to the height of the tape, they can again slow down, take a rest, and then resume lifting the knee to the height, but don't stop the stopwatch. Okay, that's an important thing. And the score is basically going to be the number of sufficiently high steps completed with the right leg in 2 minutes. And then again, you have the standard shown, so it just kind of shows how many times they could kind of get their step height to the point where they're kind of hitting that marker. Okay, 30-second chair stand test. So basically what you're going to do is place a chair against the wall, instruct the client to sit in the middle of the chair with the back straight, feet flat on the floor, arms crossed at the wrist and held against the chest. And then on the go signal, the client's going to rise to a fully standing position without using their hands, and then return to a fully seated position, and then encourage them to complete as many full stands as possible in 30 seconds. One of the things you will want to watch with this, number one, you want to make sure that the chair is braced very well against the wall, or even have someone hold it. So make sure that you have a very steady chair for this, because again, they're going to have their arms up against their chest, because the idea is they're strictly just more or less using their lower body to kind of do this. You want to watch for balance problems. Watch if they have any dizziness. Make sure they stop immediately, because sitting and standing, it could cause somebody to have some issues with that. And again, the standards again for the test is shown in 219, so you can kind of get an idea. Again, you don't have to. You're not going to have to remember the standards for every single test. Again, I do want you to know the body fat percentages, so that's an important one to note. I'm just giving you these for reference points, and again, we're going to be doing some of these tests in lab and working with that a little bit, so I just want you to familiarize yourself with those tables. And then the 30-second arm curl test. So this will be a test here we use. And again, what you're going to be doing is a 5-pound dumbbell for women, an 8-pound dumbbell for men. That's something that I would want you to know. So the client, again, is going to sit upright in a chair with the feet flat on the floor. 5-pound dumbbell for women, 8-pound dumbbell for men, beginning with a neutral grip. Have them curl the arm into a supinated position and lower as many times in 30 seconds. You're going to count the total number of repetitions that are performed more than halfway, and then just compare that to the standard. And again, you're going to want to make sure that you demonstrate proper form. I mean, it sounds simple enough, but again, for somebody who, again, this could be an older individual who's never exercised in their life. So again, it sounds simple, well, just curling a dumbbell, but those individuals, again, don't assume anything, particularly for the population. So you want to make sure the elbow is flexed more than halfway at the end of the 30 seconds. It'll count as a repetition. And then the chair sit and reach test. Again, make sure the chair is secured very well. Have the client sit on the edge of the chair with one leg flexed and one leg fully extended. The client should slowly exhale and slowly flex forward at the waist towards the toes with the arms outstretched and the hands overlapping. If the extended knee starts to flex, ask them to move back and fully extend the knee again. And then the score is going to be recorded as the maximum distance reached and held for 2 seconds. So again, you're going to be utilized. So this is a little different than the sit and reach test that we would use. This one's going to come from the chair. And then the heel of the extended leg is going to be placed on the floor. Okay. So again, they're going to be kind of sitting on the edge of the chair, one leg flexed, one leg fully extended with the heel on the floor. And again, encourage them to make sure they're exhaling slowly while they flex forward. That's another thing that you'll want them to know. Again, their arms are going to be basically in the same position that they would be in with the regular sit and reach test. So they're going to kind of have their hands kind of overlapping with each other as they reach forward. So again, they should only stretch to the point where they feel slight discomfort or muscle tension. Again, making sure that they're maintaining that fully extended position. Make sure that if they do have osteoporosis or low back pain with forward flexion, you should not do this test. Again, the higher of the two trials is going to be recorded for the test. You'll measure the distance from the tips of the middle fingers to the top of the shoe to the nearest ½ inch or centimeter, with the midpoint at the top of the shoe as the 0 point. And then if the reach is short of this point, record the distance as a negative score. So basically, if they're short by, they can't touch their shoe, they're short by an inch, that would be that would be a negative score. Okay. Whereas if they can go beyond it, then it would be a positive score. And again, the standards you could see in the tables listed here. So once we kind of have all of our, whatever tests you're going to run, now you have some data to kind of work off of with the client. So, and again, the idea is to have goals, okay? And goal setting is important. Again, if you're somebody going into, one of the professions where you're doing rehabilitation, you're going to be setting goals all the time, because that's how you kind of measure how the person's doing. For those of you that are going to be exercise professionals in that setting, you're still going to want to be able to do goal setting. So again, set goals based on deficiencies that are revealed. Short, medium, and long-term goals could then be created with some input from the client. So again, make sure that you're also including the individuals in this. You say, well, what are the time frames for short, medium, and long-term goals? I always say, your short-term goals should typically something that can be completed within about a 2-week time frame, so about 10 to 14 days for a short-term goal. Medium and long-term, it could vary a little bit just based upon what the person's working with. Obviously, your long-term goals are going to be, pretty ambitious, because it's going to be something they're going to be working on for a while. I always think that it's good to do, when you're creating short-term goals, make sure they're very achievable. Because the other thing is you're achieving the short-term goals, that kind of allows the person to see improvements right away, and it kind of motivates them to really keep going. So again, your template for creating effective goals would go with the SMART mnemonic. Again, specific, measurable, action-orientated, or achievable, realistic or relevant. So again, make sure there are things, if you're working with somebody who has never exercised before and they're kind of at a later stage in life, be realistic as to what they're going to be able to do. And time bound is helpful as well, or timed, meaning again, time bound, you're looking at your short, medium, long-term time frames, or just looking at your times that you're dealing with, for instance, some of your tests. So, there's also 7 practical principles when you look at goal setting. So, and these kind of coincide with what we talked about. But again, make goals specific, measurable, observable. Make it something that the client can actually see. Clearly identify time constraints with it. Set moderately difficult goals. So now I just said, for short-term goals, make sure it's something they can achieve. Moderately difficult goals, again, what they're basically saying there is I think that would work well for your medium and long-term goals, because it kind of pushes them a little bit more. But if the short-term goals are a little more achievable, it kind of makes that then seem more realistic to them and motivates them to do it. Diversify the process, performance, and outcomes. Make sure you're kind of hitting up all of your different physical qualities when you're doing this. Set short-range goals to achieve medium and long-range goals, and that kind of comes back to that whole time frame. Like I said, I think your short-range goals, you look at about a 10 to 14-day window for achieving them, and then that kind of carries forth with some of the other goals that you're looking at. And again, make sure goals are internalized. Again, the client should be able to participate in them. You may even want to say to the client, even before, you may kind of put together, and again, everyone will kind of work this a little differently. You may kind of put together what you sort of see as goals for the person, but in your interview process or in your discussion with them, say to them, well, what are your goals? What do you really want to achieve here? Before you even tell them what you think their goals should be. They may tell you some things that you already have outlined for them, and that's great. And if not, you should be able to work into what they want into your goals, fairly simple based upon all the information that you have. And then we look at motivation. As we all know, it's going to be very important to motivate individuals with this stuff. Again, motivation is an important factor in exercise adherence. Again, to keep people motivated to do things. Some clients are going to be naturally more motivated than others. So what you want to do is address 3 basic needs of clients to help improve their outcomes. And these factors will work into hopefully motivating the individuals to do this. So again, competence is typically when a person feels successful. So competence is something that you want to get them, and that'll assist with motivation. Make them feel like they can do something. And that's usually going to be met when they feel successful. That's why, again, a lot of your short-term goals are going to be really important for them to kind of achieve that. To get that competence. Autonomy is a third component of this, and that's going to be met when the person feels that the decision to participate is made without outside pressure or influence. Again, they have to feel a part of this. And you know this yourself, when somebody's just kind of sort of dictating things to you, that's not always met with the most amount of positivity. Get them involved in the process, okay? And that could kind of help motivate them more to think, okay, yeah, the person that's helping me here, they're really interested in what in what I want out of this, and that's a really important thing. And then, relatedness is the third part. Again, that's going to be achieved when the person feels connected to and appreciated by others. So again, that kind of ties into your relationship with the individual and kind of how they kind of feel in the process of, kind of going through some of these measures and some of these tests, what would be important to them as they're kind of, going through all of this. And again, just being a part of the process will kind of help further motivate them as well. And here are your learning outcomes. So again, make sure that you can apply all of the information we described. Can be familiar with some important points with the tests. Long form, you don't have to be able to describe the complete procedure for all the tests, but again, note important things that I kind of highlighted in the discussion. I would also encourage you to look at the key terms at the end of the chapter and be able to define those as well.